Hi, my name is Marion Kearns, and I'm the nurse practitioner from University of Maryland Midtown Campus in Baltimore, Maryland. I want to thank everyone for allowing me this prestigious opportunity to be awarded the Nicewinder Dole Award. It's been an honor and a privilege, and I'm very grateful. They say if you surround yourself with amazing people, you might do amazing things yourself. So I have the honor of being surrounded by many previous Nicewinder Dole Award recipients. And I want to mention a few right now. The first is Dr. Michael Hayes. He was awarded the Nicewinder Dole Award in 1995. He hired me, trained me, and together we built the Center for Addiction Medicine Practice, which is a booming business today. He is my mentor, he is my friend, he is my business partner, and I owe him so very much. Thank you, Dr. Hayes. I also work closely with Dr. Ingvild Olsen, who's in this audience today, I'm sure. Vicki Walters, who's the president of AATOD right now, our Maryland chapter. Ken Stoller, who is our AATOD representative for Maryland. Howard Ashkin, who is our immediate past president. Jeb Graham, Tony Tomasello, Sharon Dow, Robert Schwartz, Robert Bruner, and Ellen Weber, just to name a few. Thank you, everyone, for helping me be a great Nicewinder Dole recipient. Recently, I was part of the Robert Wood Johnson Foundation, where I met a person who is my life coach. His name is Roger Hall. And I told Mr. Hall, I said, I really don't feel like I am honored enough to be the recipient of this award. And he said to me, Marion, stop. It's not about being smart. It's not about being the brightest person in the room. It's about being persistent. And that AATOD is persistent. So I want to thank the whole AATOD team for being persistent in pursuing the culture of health for our patients and treating this as a disease that it is, for promoting the culture of health for all of us, for allowing people to learn about addiction. I think Marie Nicewinder and Dr. Vincent Dole would be very proud of what you're doing today to recognize the people in the field. So thank you for recognizing me, and thank you for allowing me to be part of this Marie Award.
Hello AATOD, I'm Hillary Cunnins. I'm here to accept the Nicewinder Dole Marie Award. As one of the award winners, I am so honored to be receiving this award, particularly in this very difficult pandemic year in which I know all of you and our field has been really challenged to do our very best for all the patients and people we serve with opioid use disorders, other substance use disorders, dealing with the many stressors of the pandemic, whether economic or health or personal or professional losses and challenges. Receiving this award this year is really especially meaningful. I have been in New York City for the last many years, most recently at New York City Health Department. And thanks to the collaboration of many, many New Yorkers, both in the field and outside, New York City and New Yorkers really rose to the occasion, particularly our provider community, who innovated in ways that many of us thought unimaginable before the pandemic. And thanks to COMPA for this nomination, and particularly Executive Director Allegra Shore, as well as the entire board of directors who stood with New York City government and with our providers to do telemedicine, to do methadone delivery, to flexibly meet the needs of our patients. Really, the heroes are so many, both in New York City, I know, and across the country. So my thanks to AATOD and the board of directors for this award. It really means the world to me. And to all of you listening, please enjoy the conference, stay safe, continue the wonderful work that you all do to improve the health of people with opioid use disorders and who use drugs. Thanks so much.
Hello, everyone. I want to say how deeply gratified I feel to receive the Marie Niswander Vincent Dole Award from AATOD. Marie Niswander and Vincent Dole were the first scientists to recognize, even before we knew about the existence of opioid receptors and the endogenous opioid system, that opioid use disorder is a metabolic, biologic brain disease that requires medication treatment in order to stabilize and treat it. I have tried to follow in their footsteps, keeping them in mind throughout my career, working as a psychiatrist at VA opioid treatment programs, providing methadone, buprenorphine, and naltrexone to my patients with opioid use disorder in order to return them to fully functional and satisfying lives. I also want to thank the Department of Psychiatry and Behavioral Sciences at the University of Washington School of Medicine, which has been my home department throughout my career, and which has nurtured me and allowed me to do the clinical work and the research that I've done to advance further the science of treating opioid use disorder with medications. So thank you, AATOD. I will cherish this award for the rest of my life. And thank you all.
Dear friends and colleagues, I feel truly honored to receive the Niswander Dole Marie Award. I would like to thank Ikram Maramani and Europad for nominating me and AATOD for giving me the award. But I also want to thank everybody that I met during all these years and who were willing to share their knowledge and experience with me. Of course, I would not have been able to stay in the field without the support and respect of my colleagues, especially all of the nurses. When I started in the field in 1982, all I knew about treatment of heroin users was what I could find in a small book in the Netherlands that did have a chapter on the use of methadone. There was virtually no training available, other resources were difficult to find, and internet was not yet available. The first time I heard someone talk about the background of methadone treatment was in 1986, when Bob Newman was one of the keynote speakers at the ICAA conference in the Netherlands. This was also when I was more or less introduced to what was then called the Northeast Methadone Treatment Alliance. This introduced me to treatment centers and people with much experience in the field, and I think that I have profited throughout the years much from this, and through this my patients and colleagues as well. And not just my patients, but many patients in the Netherlands have profited too, through contributions I was able to make to improve treatment. And now I will forever be able to say that I'm the first non-American to receive this award in an online AATOD conference. Thank you.
I'm so honored to have won the Marie Award. I'd like to thank my colleagues in Kentucky for nominating me and AATOD for selecting me for the Marie Award. I have been extremely fortunate to have worked with some really amazing people throughout the years and to have learned from some really wonderful people throughout my career. Working in medication-assisted treatment and focusing on getting individuals access to the treatment that they deserve, and working to get recognition for the rights of individuals who need treatment and need access to medication-assisted treatment is really a passion of mine. So to get this type of recognition for simply doing work that I love is really amazing. And again, this is truly an honor, and I'm extremely grateful, so thank you.
Hello, my name is Sandy. I am honored to be addressing the AATOD community on behalf of Gloria Annette Yopin. My life fundamentally changed on June 25th, 2020, as it did for many of you. On that day, the Substance Use Disorder Collective lost a valued champion. For over 2.5 decades, Gloria has tirelessly worked as a colleague, advocate, and friend. The work within SUDs is not a one-day seminar, but a lifelong passion. That passion she shared with many of you. It is my hope those of you within the organizations of AATOD, North Carolina AATOD, Vanmark, CARF International, and lastly, Salati and Company, speak her name often, continue the work, continue the fight, knowing we all have a guardian angel walking with us. On behalf of Gloria's family, I am humbled and proud to accept the Niswander Dole, the Marie Award today. Thank you.
Hi, my name is Jana Burson, and I am AATOD's recipient for the Holden Lane Award for Patient Advocacy, and I'm so happy about this and pleased and very honored. I read of all the achievements of the namesakes of the award, and they did a lot for our field. And also I read about the previous winners, and they too accomplished some huge things in our field. So I am just so honored to be in that group. So as far as my advocacy efforts, I think the main thing that I've done is written a blog that's been dedicated to opioid use disorder and its treatment with medications. I started writing it 11 years ago. It can be found at janaburson.wordpress.com. It's not monetized in any way. I just write it to give information to patients and their families and medical professionals, whoever wants information about this form of treatment, because it is so heavily evidence-based. There's so much to support what we do in this field, and what we do is so important because we do change lives. But advocacy also takes place one-on-one. For example, if I've got a patient or client in front of me who needs a letter written to support them in their recovery with DSS or the court system, sometimes advocacy means calling another medical provider and discussing with them what we do at the opioid treatment program and about the evidence that supports what we do. So I am thrilled for this award. I thank you very much, and I'm sorry I can't see everyone in person this year, but perhaps next conference. Thank you.
I'm United States Senator Bill Cassidy. Let me first say it is an honor to receive this award with fellow Senators Ben Cardin and Bill Nelson. Unfortunately, all of us know someone who has struggled with or died from opioid addiction. And I have the perspective not just as a senator, but as a physician. I know how important it is to improve treatment, eliminate stigma, increase prevention methods to address this crisis from all sides. In 2018, Congress passed, President Trump signed into law, bipartisan legislation to combat the opioid crisis. My provisions in this legislation I just learned by talking with Louisiana law enforcement officials, community leaders, and advocates like you. These conversations improved the final product, produced legislation better aimed at creating safer families and healthier communities. One of these provisions was the Comprehensive Opioid Management and Bundled Addiction Treatment Act of 2018, or we called it the Combat Act. This law allows Medicare to pay for opioid treatment programs and services, giving seniors access to the resources needed to fight addiction to return that senior to wholeness. But we know the battle against the opioid epidemic does not end with a bill signing ceremony. Congress, advocates, local leaders, we must all continue our work to ensure we implement the solutions. Thanks for your steadfast advocacy. Our work is far from over. Together, though, we are making and will make a difference. Thank you.
Hi, I'm Senator Ben Cardin of Maryland. Welcome to everyone gathered virtually for the annual American Association for the Treatment of Opioid Dependence. Thank you for all you do every day. You are touching people at what might be the most vulnerable and most difficult times in their lives. It's hard work, but it changes people's lives forever. It's why I'm so honored to receive your Friend of the Field Award along with my colleagues, Senator Bill Cassidy and Bill Nelson. Our legislation, the Comprehensive Opioid Management and Bundled Addiction Treatment, or COMBAT Act, recognized the significant and growing prevalence of substance use disorders within the Medicare population. When we first started looking at this issue, we discovered that a full 1/3 of the beneficiaries enrolled in Medicare's drug program Part D receive opioid prescription. Medicare beneficiaries continue to have among the highest and most rapidly growing prevalence of substance use disorders and opioid-related hospitalizations. The COVID-19 has not helped matters. As you know well, the isolation and economic stress of this pandemic has contributed to a 20% increase year to year in fatal overdoses and more than 81,000 deaths. Most troubling is that those numbers only go through June 2020, when COVID-19 kept raging on. All this is to say that you still have a lot of hard work ahead of you. But I am pleased to see that having treatment services in certified opioid treatment programs covered by Medicare is making a real difference and has been described by NIH as the most effective of all treatments for opioid addiction. Thank you again for this honor. Thank you to your board of directors and to your members. Please keep forging the partnerships that will improve quality of care for those in need. Keep advocating for your patients and keep educating the public about the methods that one day may save their life.
Hey everybody, thank you for the honor that you bestowed upon me and Senator Cassidy and Cardin. We are very much appreciative, but there was a need, and the need was to try to help out people that are over 65 that suddenly were addicted to opioids. And fortunately, in us being able to pass this bill, we were able to provide opioid rehabilitation treatment for senior citizens. This organization of yours is just exceptionally important. Thank you for all the work that you're doing. And thank you for addressing a major problem in this country that we were just in the right place at the right time to try to do something about. Because of opioid addiction, it has a real toll, and there are a lot of deaths. As President Biden says, there are a lot of empty chairs at the dinner table. So it's a great privilege for me to participate with you and with the two senators to trying to address this problem. Thank you, and God bless you.